Hello, good morning. My name is Girly Talents and I will be performing a newborn assessment on your baby. It's now a good time for you? Okay, great. So before we get started, I just want to double check, Mom. I want to match your wristband and the baby's wristband. Okay, great. Thank you. And so before we get started, I'm just going to go ahead and wash my hand. Okay, close this curtain. And we'll start with the APGAR assessment. So I'll be checking for the baby's appearance and the pulse, the baby's activity, and the respiratory effort. So usually the assessment will be done within the first minute of the baby's birth, and then 5 minutes later after to do another assessment. Okay, so right now I am looking at the baby. So far the skin is pink and dry, and I don't see any indications of cyanosis on the skin. The hands are clenched. The baby's breathing is unlabored and is moving freely. Okay, so that's good. And now I'm going to go ahead and assess the baby's head. I'll just be assessing the corneal and the sagittal sutures here. Okay, and also the fontanelles, in which he has the front and back fontanelles. So the fontanelles, we want to make sure that they are firm and flat, and there's no bulging or sunken or any abnormalities like that. So in this case, the baby's fontanelles are good. And so I'm going to go ahead and check the baby's eyes. So I will be checking the baby's pupils to see if they are reactive, and look for a red reflex. This is to just look for when I put my light on the baby's eyes. I should be able to see that reddish glow, which that can indicate a healthy retinal vessels. Okay, and looking for the baby's eye movements as well, and the pupils reactive to light. Okay, great. All right, so far so good. No indications of any abnormalities for the eyes. Okay, now I'm gonna go ahead and check the baby's ears. So I'm checking the top of the ears. I want to make sure that they are aligned with the lower canthus of the baby's eyes, in which they are. So no abnormalities noted there. And for the nose, I'm checking for the baby's patency on the nostrils. Okay, I want to make sure that she is breathing okay. Nose are symmetricals, and I don't see any flaring up the nose, so which is good. Okay, and for the mouth, I will be checking the baby's palate. So I'm going to go ahead and put my gloves on here. So I'm just going to go ahead and strike my pinky, my index, in the baby's mouth to feel around the roof of the mouth to make sure that the cleft palate is intact, or the palate is intact, okay, in which they are, and the baby's sucking reflex is good. Okay, good. And let's see the baby's rooting reflex. I want to see if the baby should turn its head towards my finger, in which she is doing right now. Okay, that's good. And so the lips and mouth are pink, and they are symmetrical on both sides, which is good. The shape are good, and the mucous membrane is intact. Okay, and next I'm going to go ahead and check the baby's neck. I want to make sure the baby's neck is, and the clavicles as well. Make sure there's no crepitus or any broken bones. Okay, I don't see any indications of crepitus. Okay, the neck is symmetrical. No signs of lesions or masses, which is good. And check the chest. Baby's chest is symmetrical. The arms and the legs are symmetrical. The creases are present here on the arms as well as on the legs. Checking for any webbing, and no webbings on both hands. Same with the feet, no webbing on the feet. Checking for the range of motion. Okay, good. Baby has a good muscle tone. And then I'm going to see if the baby's clenching on my fingers, and what she is. This is the palmar grasp. And then I'm going to do the plantar grasp. I want to see if the baby is curling his toes on my fingers, in which he is, which is good. Okay, great. And now I am going to auscultate the baby's heart. But before that, I'm going to go ahead and feel the baby's pulse on both sides of the arms. Okay, baby's pulse is 130, which is normal. And then the femoral. Okay, good. More pulses. Good. All right. Now I'm going to go ahead and auscultate the baby's heart. I'm going to clean my stethoscope. I'll be using the bell part of my stethoscope to check the baby's heart, okay? And for the apical pulse, I'll be listening to it for 1 minute. Okay, great. heart rate and rhythm is good. So heart rate is 130. I'm sorry, the lung sounds, heart rate is 130. Sorry, 130, and no murmurs noted upon auscultation. Okay, and then right now I'm going to go ahead and listen to the baby's lungs. Again, I'll be using the bell side of my stethoscope. Okay. All right, so lung sounds clear, and I know labored breathing noted, and it is within the normal range. And then it was 44 beats per minute. Okay. And then now I'm gonna go ahead and listen to the baby's bowel sounds. I'm gonna start at the right lower quadrant. Bowel sounds in all 4 quadrants are clear and active, normal active, and everything sounds good. And now I'm going to go ahead and check the baby's temperature on the axillary part. Okay, temperature is 36.6, and that is good, and that is within the normal limits. All right, now I'm gonna go ahead and check the baby's genitalia to check for that everything is intact and appropriate for the sex of the infant. Okay, let me just go ahead and put my gloves on. All right, so I'm checking the baby's genitalia. In this case, this is a female baby, and no indications of any anomalies or abnormalities. I see the baby's labia majora and labia minora are intact, with a visible vaginal opening, and the orifice, central orifice between the labia minora is intact as well. Okay, great. That's that. And now I'll go ahead and check the baby's umbilical cord. I am looking for any redness or swelling or drainage or bleeding on the baby's umbilical cord. And in this case, I don't see any indications of any redness or swelling or drainage. The cord is clumped and in good appearance, and I see 2 arteries and 1 vein. okay, which is good. And then so the umbilical cord stump typically dries up and falls off within 1 to 3 weeks after birth. Okay, and then right now I'm going to go ahead and check the baby's back. Just going to turn the baby around. Now I'm assessing for any spine curvature. I'm looking for any deviation or curve in the baby's back, spine. In this case, the baby does not show any abnormalities. And then I'm also looking for any Mongolian spots, in which I don't see any. Okay, so Mongolian spots, they look like a birthmark, but just wanted to let you know that they could look like bruises, but they are not. Okay, they're not bruises. So, and Mongolian spots are usually common in other cultures, such as Asians, and other cultures as well. Okay, and assessing for any dimples or tuft of hair near sacrum, in which I don't see any, no indicative of spina bifida or other abnormalities as well. So that's good. And now I'm going to go ahead and measure the baby's head and chest circumference. Look at the baby's head. Okay. All right. So head circumference is 34 centimeters, which is good. Now I'm going to go ahead and do the chest circumference. Okay, chest circumference is 32 centimeters, which is also normal. Good. All right. All right, Mom, so that's the end of the baby's assessment. So far the baby looks healthy, and so far there's no indications of any abnormalities or anomalies on the baby, okay? And also, I wanna also emphasize that when the baby is in her crib, whether she's sleeping or awake, we want to make sure that there's no stuffed animals or loose additional blankets in the crib, okay? This is just for a precaution to prevent the baby from any danger or suffocation, okay? And also make sure that you have the bulb syringe at the crib side, just to for when you need the suction to suction the baby, okay? So for when you do need it, it's just right there. And then so that's it. If you have any questions, please let me know. And again, thank you for allowing me to perform an assessment on your newborn baby. And thank you. And again, let me know if you have any questions, okay?